This is an in-service on taking care of your back. You want to make sure that you go through and read all of the materials that are attached um, to this in-service. If you have any questions about anything, please make sure that you call the office at 972-270-2000 to speak with Latanya. After finishing this in-service, you will be able to name at least 4 factors that put people at risk for back problems, describe 2 common back problems, discuss at least 3 ways that back pain is treated, describe the 3 natural curves of the spine and how they relate to posture, and demonstrate correct posture and body mechanics as you function in your job. Okay, let's get started. Taking care of your back. It probably comes as no surprise to you that healthcare workers are the top of the list for work-related back injuries. Most nursing assistants who hurt their backs do so while transferring or lifting a client. In most industrial jobs, women are not expected to lift more than 50 pounds, but in healthcare, women are often expected to lift clients who weigh several hundred pounds or more. And it's not much better for men in healthcare either. Every day you bend, lift, stretch, twist, stoop, push, and pull over and over and over again. Often you must work quickly, without assistance and with few rest periods. So what's the bad news? Over time, your responsibilities at work can take a real toll on your back, putting you at risk for back trouble. But don't worry, there's good news too. There are many things you can do to make sure your back stays healthy and pain-free. Let's go over some interesting facts. Low back pain is as common among people with desk jobs as it is among people who perform heavy labor. More than 85% of adults have at least one episode of low back pain during their lives. When you lie on your back, there's only 25 pounds of pressure on the disc of your lower back. Lying on your side increases the pressure to 75 pounds. When you stand up, there's 100 pounds of pressure on your lower back. Lifting a 10-pound weight makes the pressure jump to 220 pounds. Lifting 70 pounds puts up to 1,000 pounds of pressure on the lower back. So just imagine how much pressure your back feels when you lift a 200-pound client. Every year, there are nearly 400,000 work-related back injuries in the United States. These injuries are responsible for 93 million lost days from work. Most back pain develops when people are between the ages of 25 and 60, but up to 26% of children have episodes of low back pain. Every year in the United States, at least 31 million people suffer from back pain. It costs $60 billion to treat them. Back pain is the leading cause of disability in men younger than 45. Unless pain travels way down the back of the leg, there's only a 1 in 1,000 chance that it's caused by a bulging disc. Bending over or leaning down puts tremendous pressure on the lower back. And it's even worse if you are overweight. For example, a guy who is 25 pounds overweight puts an extra 250 pounds of pressure on his back every time he bends over. Who's at risk for back problems? No matter what kind of work we do, we are all at risk for back pain if we sit or bend a lot, lift, move, or carry things incorrectly, are overweight or pregnant, smoke, don't exercise regularly, are under stress, play sports, have had previous episodes of low back pain, have poor posture while sitting, standing, or lying down, have weak back and or abdominal muscles, come from a family with a history of degenerative disc disease or degenerative arthritis. Another risk factor is age. This means that the older we get, the greater chance we have of developing some type of back problem. What about back belts? Millions of Americans wear back belts for their jobs in an effort to prevent back injuries. But do they work? According to researchers, the answer is no. There seems to be no difference in the number of back injuries between workers who wear belts and those who don't. In addition, studies have shown that most back belts aren't worn properly. They should be worn very low over the front part of the abdomen. Most people wear them around their waist, which does no good at all. They might as well be wearing them around their necks. Symptoms of back trouble. Pain that throbs, aches, shoots, stabs, and feels either dull or sharp. The pain may seem to move to different parts of the body. Numbness or weakness in the legs. Pain in the lower back and legs that only happens when you are in certain positions. Pain that gets worse when you are tired or under stress. Pain down one or both legs with or without pain in the lower back. Sleep problems, decreased energy, and depression and or anxiety. Back pain can throb or pound, pinch or cramp, ache or tug, stab or burn, sting or squeeze, shoot or radiate. Types of back pain. Acute pain is usually short-lasting and serves as a signal that something is wrong in the body. Acute back pain is frequently caused by a sudden injury. Chronic pain goes on and on for months or even years. The cause may be known or it may be a mystery. Mild pain does not interfere with activities. Moderate pain interferes with activities but is not disabling. Severe pain is disabling and keeps people from functioning. Important. Please keep in mind that you can't judge the seriousness of a back injury by the amount of pain. Some severe problems may cause only minor pain, and some minor injuries can cause intense pain. When to see your doctor. Don't ignore your back pain if your symptoms are severe or last longer than a few days, the pain keeps you from doing your normal daily activities or wakes you up at night, your legs feel weak, you have problems controlling your bowel or bladder, you feel numb in the groin or rectal area, the pain is worse when you cough or sneeze, or the pain or numbness travels down one or both legs. Your neck. When you think about it, the neck is a pretty remarkable structure. It can move forward, backward, tilt from side to side, and rotate in both directions. In addition, it is strong enough to support your head all day long. However, all the great work done by your neck puts it at risk for being overused. Here are some common reasons why you might develop neck pain. Cradling a telephone between your neck and shoulder, propping your head on pillows to read or watch TV while in bed, sleeping on the wrong type of pillow. Sitting in front of a computer for long periods can be really hard on your neck and back. The spine is made up of small bones called vertebrae. These bones are stacked on top of each other to form a column. Between each vertebra is a disc that acts like a cushion. The vertebrae are held together by ligaments and supported by muscles. The spine forms three natural curves that give it a shape like the letter S. The spine has a number of important jobs. It supports the body and head, gives the muscles and ligaments some place to attach themselves, allows your body to bend, lean, and twist, protects your spinal cord and nerves. The lower part of your back supports most of your body weight. Even a minor problem with the bones or muscles in this area can cause pain. Here are some common reasons why you might develop lower back pain. Carrying items, sleeping in an awkward position, lifting heavy objects, working in awkward positions day after day, having an accident such as falling downstairs or being hit by a piece of equipment, or having poor posture. Sprains, strains, and spasms. Back strain, Back sprains and strains are very common and probably cause most people's back pain. Muscles and tendons can become strained by tension or overwork. A strained back usually heals itself within a few weeks. With a sprain, a joint is forced between its normal range of motion, which stretches and tears the ligaments. Muscle spasms may occur when a muscle is tired or strained. Sometimes the back muscles will spasm in order to hold an injured spine in place. Spasms can be very painful. Important: muscle strains and sprains are not serious conditions, but they can lead to chronic back pain if muscles continue to be abused. There isn't one easy test or diagnosing back problems, but X-rays and MRIs are sometimes helpful. Bulging and herniated disc. The bones of your spine are separated by small cushions of cartilage called discs. Each disc has a soft, squishy center surrounded by tough outer rings. As people age, their discs lose moisture and don't bounce back into places easily. You may have heard of a slip disc, but discs don't really slip, they can begin to bulge out from between the vertebrae, often as a result of years of poor posture. The bulging disc gets squeezed by the vertebrae. This may cause pain or may be no symptoms at all. Sometimes a bulging disc ruptures, putting pressure on the nerves. A pinched nerve can cause pain, weakness, and numbness. Sometimes a pinched nerve causes a condition known as sciatica. Typically, sciatica pain begins in the buttocks and travels down the back of the thigh and calf and even into the foot and heel. It causes a burning or tingling feeling down the leg, produces weakness or numbness in the leg or foot, causes a shooting pain that makes it difficult to stand up. Sciatica can be very painful, but it does not usually cause permanent nerve damage. Most herniated discs can be treated without surgery by a combination of physical therapy, medication, and exercise. Bending forward or to the side may increase the pain of a strained back. The pain may also be worse in the morning. Later in the day, as the muscles warm up, the pain often decreases. Treating back pain. Bed rest. For severe back pain, your doctor may suggest a few days of bed rest. However, in most cases, bed rest should be limited to 2 or 3 days. Lying down for longer than this may weaken the muscles and bones, causing a slow recovery. While resting, you should try to get up every few hours and walk around, even if it hurts. Feeling a little discomfort is normal and does not mean that you are doing harm to yourself. Important: avoiding all exercise when your back hurts can cause your muscles to decondition. This means they may become weaker and weaker, putting them at greater risk for injury. Medications. Some people take anti-inflammatory medications such as Motrin or Tylenol to relieve their back pain. It's important to remember that even over-the-counter drugs can be abused. It's best to take them only when recommended by a doctor. A doctor may prescribe other medications to decrease pain, reduce swelling, or relieve muscle spasms. Anyone taking these drugs should be aware of potential side effects, including addiction. Some types of back pain respond when medication is injected or implanted directly in specific muscles, nerves, or joints. Most low back pain is acute and will resolve by itself in a few days or weeks, with or without treatment. If the pain continues longer than 3 weeks, it is considered chronic. Surgery. Having severe back pain does not mean that you'll need surgery. Back surgery has been found to be helpful in only 1 out of every 100 cases of low back pain. There are certain back conditions such as tumors or infections that must be treated with surgery. For the most other back problems, having surgery is a choice. It's important for people who are considering back surgery to learn as much as possible about their condition and about the type of surgery suggested by their doctor. Other treatments for back pain. Heat and cold. Within the first 48 hours of having back pain and/or muscle spasms, you may want to apply a cold pack to the painful area for 5 to 10 minutes at a time. After 48 hours, a heating pad, hot shower, or hot bath may help to relax the affected muscles. Note: the relief that comes from applying heat or cold is usually temporary. Ultrasound. Ultrasound involves the use of high-frequency sound waves. The tissues in your bodies are able to absorb these sound waves, producing a deep heat well below the surface of the skin. Physical therapists often use ultrasound to treat back pain. Massage. Massage increases blood flow and relaxes muscles. It may help decrease back pain and spasms. Sometimes the massage itself will cause pain until the affected muscles begin to relax. Massage is also a temporary measure. It doesn't fix the underlying problem. Acupuncture. Acupuncture is an ancient practice developed centuries ago in China in which thin needles are inserted into the skin at certain points on the body to relieve pain and treat disease. There are more than 2,000 acupuncture points on the human body. The needles used for acupuncture are solid, sterile, and slightly bigger than a human hair. People say they feel the needles pierce the skin, but that there is no pain. A standard acupuncture session costs from $50 to $70 and is sometimes covered by insurance. Traction. Traction is used mostly in cases of lower back pain. The idea of traction is to pull the vertebrae away from each other, relieving pressure on the disc. Corsets and braces. Some doctors prescribe the use of a corset or a back brace in order to restrict movement, support the abdomen, and correct a person's posture. Some people wear back braces after spinal surgery or because of a spinal fracture. Tips for a healthy back. Practice proper body mechanics and posture throughout the day. Sitting. Choose a chair with a firm back whenever possible. Sit with your buttocks up to the back of the chair. Place a rolled up towel or small pillow in the small of your back when sitting in a seat without good back support. This may include the time you spend sitting in a car or at a movie theater. When sitting for long periods, get up and stretch often. Standing. Stand up straight without slouching. If standing at a counter for long periods, place one foot on a small stool or open a lower cabinet and put your foot on the bottom shelf. Sleeping. Turn and flip your mattress every 6 months. Sleeping on a firm mattress is best for your back. Try putting a small pillow between your knees when you sleep. This helps keep your hips lined up and may prevent lower back stiffness. Working. Use available equipment to help you lift or transfer a client, such as gait belts, Hoyer lifts, sliding board, and draw sheets. Take advantage of electric beds by raising the bed to a comfortable working height. Just remember to lower the bed again when you're done. Always bend your knees, not your waist, when picking something up. Before lifting anything or anyone heavy, ask yourself these questions. Can I lift this load safely by myself? How far do I have to carry this load? Is there a clear path for me to travel with this load? Are there any closed doors in my path? And will I be able to see where I'm going once I lift the load? Center your body over your feet and let your legs do the lifting. Lift in one continuous motion without jerking. Avoid twisting your body while lifting. If you must turn, turn with your feet, not with your body. Look straight ahead while lifting. Don't look down. Remember to get assistance from other people or equipment before you try to lift or transfer a heavy client. If you don't, your back may suffer. More tips for a healthy back. Driving. Adjust your seat close to the steering wheel. Keep your knees and arms bent to avoid straining your back. Use a headrest in your car. Use armrests if your car has them. Do some shoulder rolls at stoplights. Stop every hour or two on a long trip to walk around and do some stretches. General tips. Wear proper head protection when riding a bike or playing sports. Maintain a healthy weight. Get regular exercise at least 30 minutes every other day. Be sure to warm up before exercising. Include stretching exercises to increase flexibility and prevent injury. Do some strengthening exercises for your back, legs, and abdominal muscles. Add some aerobic exercises such as walking or swimming to help keep your weight down and to increase your circulation. Carry groceries and shopping bags with handles rather than by balancing bags on your hips. Make sure that your TV is at eye level or slightly above and face the TV set directly while you are watching it. Wear good shoes. If you wear athletic type shoes for work, consider replacing them every 6 to 8 months. Athletic shoes are made of soft materials that tend to flatten after repeated use. This means your foot will not be supported as the shoe wears out. If you already have back pain, be prepared to explain to your doctor where, when, and how your back hurts. Be ready to tell what increases your pain and what makes your back feel better. Consider keeping a pain diary if your pain is chronic. Record what you experience day by day, week by week. For example, write down the level of pain you felt each day and what you did about it. Note whether your back felt worse at a certain time of the day. Describe any exercise you've done and how it made you feel. Details like these may help your doctor diagnose and or treat your pain. Follow your doctor's recommendations regarding diet, exercise, and other treatment options. If you have a choice, push, don't pull. It's much easier on your back to push a heavy load than to pull it. Think about a wheelchair. Isn't it easier to push than pull? Treat your back to perfect posture. Bad posture is a habit and can come from a combination of things, such as watching television from an awkward position, sleeping on a mattress without good support, having weak muscles, being overweight, being stressed out. The key to good posture is maintaining the balance of your spine's 3 curves. The cervical curve is made up of the 7 small vertebrae in your neck. It has a slight forward tilt. The thoracic curve includes the larger vertebrae in your chest. It is rounded with a backward curve. The lumbar curve is made up of 5 very large vertebrae. It has a forward tilt. Remember, if you hunch your back by slouching forward, you'll stress the disc in your lower back. If you sway your back by arching backward, you'll stress the muscles and ligaments of your lower back. Keep in mind that the military stance of chest out and shoulders back is not good posture. It causes too much sway in the back. Standing up straight means keeping your back's natural curves in balance. Imagine a straight line running from your ear past your shoulder to your hip and then down past the front of your knee and ankle. The muscles of your back, legs, and especially your abdomen help keep your balance, whether you are sitting, standing, or lying down. To check your alignment, try this. Stand against a wall with your heels about 2 inches away. The space between your waist and the wall should be no more than the width of your hand. For many people, this does not feel normal since they are used to a larger curve in the lower back. And to balance yourself properly, stand with your feet flat on the ground, relax your knees, tilt your tailbone slightly under and forward, drop your shoulders, expanding your breastbone slightly, tighten your abdominal muscles a bit, Relax any muscles or joints that are tense. Good posture gives you more energy by letting your blood circulate better, helping you breathe deeper, and allowing your internal organs to function better.